I don't know if I told you this last time, but I usually go with lidocaine because it's really fast acting.
Yeah.
And then follow it up with Marcaine. So I don't know if we brought that point home last time.
Yes.
Lidocaine's got the red label for the doctors that don't ever use these.
Yep.
I'm just going to unscrew it off. You're going to put it in the hole.
Okay.
Screw it on. Then you're going to pull this back. Drop the cylinder, the back in first. Let it in. And then deliver it home.
Okay.
And then tap it like that.
All right.
There we go. So this will be, open wide for me. So just like the last guy, I want to put this cap on there. I'm not actually going to poke you, so don't jump, okay? There's not going to be a needle. I want to show them where I'm going in. So once again, you're going to come over the second premolar. This the second premolar.
Yeah.
Shoot straight across right into this fossa.
Okay.
And that's going to be the injection.
Okay.
With this length needle, you're going to take it about 3/4 the way in. So what I like to do is have my hand in the way.
Okay.
And to prevent her from moving a little bit.
So where's your hand in the way? I mean, you basically got your thumb in there just to...
Yeah, so I'm palpating where it's at just so I know where that little dent is.
I hear you.
Do you see it where it's at?
Yeah, I'm going to magnify just a little bit. It takes 2 seconds.
Give her a little bit as I go in. Advance a little bit more. Give her a little bit more. Go in a little bit more. Pull back. See if you got any blood. Give a little bit more. Stick it in. Aspirate. I walk it in.
Okay.
Because if you go straight deep, they tend to not like that.
Okay. So you inject a little bit, go in a little bit more, inject a little bit.
Correct.
Okay.
And this is about the easiest spot to get a positive aspiration. So that's the end. I don't expect her to be numb quite yet from that. What I'm going to do is I'm going to give her the long buckle now.
Okay.
This is a good one to see. So we can see, let's see. Tilt your chin down for me. There we go. When I palpate right here, this is the external oblique ridge.
Uh-huh.
Right there.
Got it.
The long buckle is on the soft tissue side. So on the other side of this bone right here.
Okay.
So I'm just going to take it in like this. And usually it comes straight on.
Okay.
On the outside of the bone. Don't pinch, sweetie. And this actually numbs the whole cheek and buccal mucosa area. Good. Does it feel like half your lips getting numb yet? Does it feel numb right there?
Not really.
Okay, we'll give it a second. I'm gonna give her the rest because the lower is the hardest to numb.
Okay.
So I'm gonna use the rest of this to give her another IA with it.
Okay.
And then I'll follow up with the Marcaine.
Okay.
But I'm gonna wait till she gets a little bit tingling right here. So this is a longer acting. You should be numb in this area, okay? I just want to give you a good long-term numbness. So same exact spot, going in. That time I struck bone.
Mm-hmm.
And if you give this injection and they jump out of their seat, that's actually kind of good because that means you hit the nerve and that's where you're technically aiming for. This is the most missed.
But if you hit the nerve, you back off just a little bit so you're not injecting into the nerve, of course.
Correct. But this is the most missed injection there is in dentistry.
Okay.
And so when you hit the nerve, at least you know that you actually didn't miss.
Right.
You're aiming for it. So that should be good.
How's the numbing?
Don't fill my mouth too much.
You're talking funny too.
Does it feel numb halfway down the face? Good, good. Out of pain?
Yeah.
Our dentist the best?
Yeah.
Yay, Dennis.
All right.